Welcome back to Mind Matters. In today's segment, depression can be debilitating for anyone, but it also affects young people differently than it affects adults. So here to discuss how it affects teens is Kim McClelland of Brentwood Hospital. Kim, thank you so much for being with us today.
You're very welcome.
Of course. So I want to make sure our viewers get this information. So when you're talking about depression, what are some things that can be different or can be a different experience for teens versus if someone is an adult experiencing depression?
Sometimes they look like they're very angry. You can see anger. And adults can get irritable too, but that's not what you usually see. You just see great sadness. But with adolescents, you can see more anger and really acting out. And you really want to watch just a complete change in who they are.
Yeah.
You know?
And for parents or loved ones who are watching and they have a teen in their life that they want to be on the lookout for, what are some things that can cause or can lead to depression in a teen?
What can lead to it is the pressures that they're under. There's so much pressure with school, with grades, and getting involved. And if they're on their track for going to college, making sure that they're doing enough to get that resume ready. And the peers, the pressures with the peers. One day they're best friends, the next day they're not. And then they also worry about world events, and right now the world doesn't feel like it's on solid ground. So that causes them a lot of concerns.
And that can also be compounded with things that can go on in their lives, like a loss of a family member.
Of course.
A death or something like that, a big event. So it's a lot that can happen. So if I'm a parent or I'm a caregiver, a loved one, what would you say if I'm the parent and I am seeing some things in my child, they're acting differently, they might be more angry, they might show some of those symptoms, what are some of the best ways to support that teen?
I think the most important thing is if you've seen a big change in their behavior, and they're starting to either lose weight, gain weight, their grades are dropping, they're either not sleeping well or they're sleeping a lot more, you need to ask the question why. Why is this behavior changing? And get someone, a professional, to do an assessment and find out what's going on with them.
And how, as a parent, do you know whether it's, puberty and kids just growing up, maybe having some mood swings, for example, or just growing pains versus depression? How do you know when it crosses that line?
Depression is bigger, and when a person is depressed, even teenagers, it's heavy. It's a very big weight. And things that they used to care about, they don't care about anymore. And you also may see a change in the way they're dressing. All of a sudden, they're wanting to wear long sleeves or a lot of bracelets. They don't want to put on a bathing suit. You may be looking at someone who's doing some self-harm, which is kind of the first step in, us seeing that there's a big problem.
And why is it so important to pick up on these things early? We're talking about teens, so before they become full-fledged adults, why is it so important to narrow in on these things now?
The second leading cause of death for an adolescent is depression. It's suicide. And the first leading cause is accidents, but we don't know exactly how many of those are, I don't care, so I'm going to do really risky behavior.
And I want to also ask, for parents, what kind of help is out there, or what kind of help should they be seeking? You mentioned talking to a professional. It doesn't have to be that they just jump straight to a medication or something like that, does it?
No, I would at first get an assessment with a therapist before doing anything else. And, having that person looking into the why. And then one of the questions as the professional, we would look at family history. We'd look at the events that are going on with them. And one of the things that I can tell you from working with children and adolescents, the majority of the times the parents do not know what it is going on. Because an event that is really significant for them doesn't look so significant for an adult.
So it may be that they're experiencing things that parents might not even know are going on.
Or they know about it, but they didn't see it as a big deal.
And so it's a lot. And so I guess the other key is just talking to your kids regularly.
Yes, and whenever your child wants to talk to you, You need to be prepared to drop what you're doing and listen, because it may not come back around.
That's true. They want to take advantage of that openness with them. So thank you so much, Ms. McClellan, for coming and for sharing all this information with our viewers.
You are very welcome.
Thank you.